Incredible that Justin Trudeau has managed to double our national debt and add more debt than all previous federal prime ministers combined without improving health care. In fact, by all accounts, he's made it worse, and some even say our health care system is broken. Health care is broken, and the federal government is broke after 8 years of Justin Trudeau. He had money for the We Charity, $54 million for the useless and broken ArriveCan app, over $100 million for the McKinsey high-priced consultants, but he doesn't have enough money for health care. And so yesterday he announced sums that are not adequate, according to the premiers, to fix the health care damage that has emerged under 8 years of Trudeau. Obviously, a future Conservative government led by myself will keep in place these additional sums and honor the commitments made yesterday. But we regret that the Prime Minister broke the federal bank and wasted so much money that he now cannot come to the table and help relieve the suffering in our emergency rooms and on our wait lines that have grown out of control under his 8 years as Prime Minister. A Conservative government will unleash the productive forces of our economy so there is more money available to support health care. We will cut the waste and mismanagement in the federal government, including the high-priced consultants, so that more of your tax dollar goes to the emergency room and to treating your family. That's the Conservative approach. Now let's bring it home.
So Pierre Poilievre, just moments ago, as he spoke to reporters on Caucus Day, as we look live at Ottawa, his response to that plan, the health care funding plan, revealed yesterday by the Prime Minister to the premiers as they gathered in Ottawa. I want to bring in our chief political correspondent, Rosemary Barton, who's in Ottawa. Questions for you. Good morning, Rosie. Number one, it's great to have you back with us. Long time. So before we get into some of the things that the premiers are saying, listening into what Monsieur Poilievre just had to say there, I'm just wondering your take on his response. Everything is broken, including health care, and Canada is broke. We've heard some of those lines before.
Yeah, obviously that's part of a story, that a narrative that Pierre Poilievre is trying to get Canadians to tap into. Obviously, there are some Canadians who believe that and are frustrated with the state of the country, and he's pointing to the healthcare system as another example of that. Put that aside, because that's the politics part of what he said. Thought there were two interesting pieces there of information. One, that although he too doesn't believe that this is enough money, because the provinces say it's not, he would keep the funding going forward were he to become Prime Minister, were he to form government. And it sounds to me like he would look for more money to be injected into the healthcare system. And his suggestion there, Heather, seems to be that he would come up with that money by cutting things and restricting and changing regulations and getting rid of red tape. That's the part that I think we're going to need to hear more about. Where is that money actually going to come from if he does intend to invest more in the healthcare system? But certainly the fact that he would keep what's there is a bit of news and sort of interesting to note.
Okay. The premiers you mentioned, coming out of the meeting, they hadn't seen the details yesterday. They came out of that meeting saying really not completely impressed. The money wasn't enough, but Prime Minister Trudeau calls it a major investment in healthcare. So explain this gap.
Well, I mean, it is about the dollars, right? Is it a far cry from what the premiers were asking for, which was $28 billion more over each year. They're getting in the vicinity of 4.5 and going up over time. So that's a big difference. I would say that the premiers knew very well that they weren't going to get that amount going in yesterday, but they hoped that they would get more. They did get one of the pieces that they were looking for, and that is that there will be, under this new deal, a new floor for the Canada Health Transfer. Before it was 3%. Now it will be 5%. That'll remain in place for 5 years. And then that money will be compounded into the Canada Health Transfer going forward. That provides them, I think, some stability, and that was one of the things that they were asking for. The Prime Minister is obviously trying to sell this to them and get them to endorse it, be okay with it. But let's be clear, the Canada Health Transfer is not something they have to sign on to. They have signed on to it. This is what is being offered. This part is not a negotiation, the health transfer. This is what they are going to get. It's the other piece, these bilateral deals, where there is perhaps a little bit of room for conversation. And there's $25 billion on the table there, with some conditions attached, which most premiers, including the Quebec Premier François Legault, seem pretty okay with. And that's the money that they need to go back to their own provinces and decide where that would go and how that would work and how much they can get of that pool of money. But the broader sum here in terms of the transfer that they can expect for the next decade, that's it. It's on the table. It's not a take it or leave it. It's a take it. They don't have to be happy about it, but that's all that's on offer, and it is not a negotiation piece for the federal government.
Along with money, there was a lot of talk of data collection, outcomes, accountability from this new funding. So what is the Prime Minister asking for, and how are the provinces reacting to that?
So the data had been in the past sort of a controversial piece of this. Some people a little reluctant to hand over any information to Ottawa, given that they run healthcare, provinces run healthcare, and they make the decisions. They seem to have cleared that hurdle in terms of understanding why that might be helpful. And it might be helpful for a whole bunch of reasons. For citizens to sort of compare the state of healthcare systems across the country and access they have. It might also help from a human resources perspective to know why there are more nurses or doctors in one part of the country than another, and how you might be able to shift some of those people around. The other piece, the conditions that I was talking about, that is also important. That is attached to the bilateral deals. And in that, Ottawa is asking for kind of action plans. What are you going to use this money for? What would be your targets? What would you tell your citizens about how you're using this money and how it's improving the healthcare system? If there's one thing everyone agrees with, Heather, it's that money isn't going to fix any of this, and money isn't going to fix it all overnight. Certainly money will help, but they need to be doing all these different things at the same time. And to their credit, provinces are trying new and innovative things to attract more people and to run their systems better. But the federal government wants the provinces to be accountable, not just to Ottawa, but to the people in their provinces about how that's going. And so that's where they will have to publish some of that data to let people evaluate for themselves.
So then let me ask what we watch for next in terms of these bilateral deals and negotiations. Yeah. Is this going to roll out like we saw with the National Child Care Program? Is that what it's going to look like? What happens next?
Yeah, I think that's a fairly good comparison. It's also sort of the way this government tends to work, the federal government. They offer something and then they go off and make side deals. And let's be honest, when you have one province start to give in, it's a lot harder for other provinces to not do that. I think you heard some cracks in that already from that so-called United Front from the provinces yesterday, even though they've decided to go back and talk about it and then have a meeting. You heard Tim Houston talk about how great the needs were in his province of Nova Scotia. You heard the Premier of PEI talk about how he needs money. So I think you will start to see some provinces engage very quickly in creating these side deals and negotiate them quickly with the federal government. Others may take a little longer, perhaps because there are political reasons for them to put up a bit of a protest, perhaps because they're not sure that this is the best solution. But if there's money on the table, and you heard even Doug Ford say this yesterday, there's money on the table, nobody's going to leave the money there. So how quickly it gets done, I think, will be interesting, but I would expect some provinces to move pretty darn fast.